be there. Type
Recording in progress.
3, 2, 1.
Good evening, everyone. It gives me immense pleasure to welcome you all to this exciting round of Fever Foundation postgraduate. Before we go to the quiz, I thought I'll just brief you about Fever Foundation, then we'll get on to the quiz. Fever Foundation is an independent body, non-commercial foundation, which caters to supporting the education to make scientific initiative aimed at providing evidence-based updates to all the healthcare professionals. If you look at the vision of Fever Foundation, it strives towards imparting knowledge on the unmet needs, providing information on research, education, therapy updates on fever management. So what are the various activity do? We do annual fever conference. Already 6 conference is over. This year we are going to 7th annual conference. We do fever CMEs across India and various for physicians, family physicians, etc. and pediatricians. We bring about book on fever management. Every year we bring about 2 books on fever management. And we also do clinical and epidemiological research, challenging case presentation competition for postgraduate, young scholar awards, and patient education, paramedical, public awareness activities. So this year we started a very special activity. I just want to show you what are the things we did. This year we started Fever Week. First time in India, first time in the world ever Fever Week was conducted between 24th to 30th May. It was commemorating the birth anniversary of Sir Gabriel Fahrenheit, who invented thermometer and the Fahrenheit scale. And we had a panel discussion, national panel discussion on 24th May for all pediatricians, 25th May for physicians. And we conducted CME across on fever. More than 100 programs were conducted through in that fever week. And we did patient education and public awareness activity through the entire week through FM radio. So our advisory board members could give all the local language, regional language, Hindi, English, everything was played on the fever, what to do, myths and facts, etc. And we have started the fever research activity. First original research activity has been initiated at Ellen Medical College, Bhopal. And now we are here for a quiz program. We are playing a zonal quiz. We have 4 quizzes, north, east, west, and south. 23rd, 24th, 25th, 26th July. And pediatricians quiz will be at 4 p.m. and post-graduation internal medicine every day at 7 p.m. So today is the day 1 of the quiz. And we also have, I would like to inform you that a poster competition for every year we do for FEFCON, pediatricians and the internal. All this poster has to be related to fever. Last date for submitting the poster for this competition is 10th September 2024. And the poster presentation, actual competition will happen on 17th or 18th of October. And then we are also planning fever management certificate courses, especially catering to general practitioner and family physician. And I just would like to tell about FEFCON 2024, which is going to happen in November 23-24. And the winners of zonal, this quiz will be coming to the national, the grand finale, which happens on 23rd or 24th of November. Sorry, this 2024. Then I would like to introduce our quiz host, Dr. Jagdish Chennappa, sir, consultant cluster head pediatrics at Manipal Group of Hospital, Bangalore. He's a past president of Respiratory Chapter, Indian Academy of Pediatrics. It's CEO at Bangalore Med Train LLP, consultant at Child Central Bangalore, and he is also advisor to Fever Foundation. He helps us with all the scientific activities. Sir, it's our pleasure and privilege to welcome you, sir. We have with us quiz master, Dr. Professor T. Sukumaran, sir. He's a former professor, head of the Department of Pediatrics at PMS Tiruvalla, past president of National President IAP, National President of IAP Respiratory Chapter, National President of Allergy Immunology Chapter, Best Doctor Award from Government of Kerala, Professor of Pediatric in various medical colleges, and he has written several books, fever, allergy, respiratory diseases, etc. And he has also headed in the Fever Foundation. Who is going to be there as a quiz jury? We have Professor Dr. M.K. Sudarshan, sir, Chairman, Karnataka State COVID-19 Technical Advisory Committee, Government of Karnataka, ex-director and retired dean, principal and professor of HPD of Community Medicine, KIMS, Bangalore. He's also a member of WHO Expert Consultation on Rabies, Geneva. And sir is a NABL assessor for many of the ethical committees, etc. So he's done a lot of work. So sir will be our jury for today's quiz. Dr. Sudarshan, sir, it's my again pleasure and privilege to welcome to you, sir.
Thank you.
So I'm going to tell you the quickly for all the participants, the rules and regulation. The quiz is only for the postgraduate student of the zonal, that particular zone. The quiz consists of multiple choice questionnaire. The participant has to log on through Zoom platform, which is already there, and answer to be done through the link, which is all the time quiz duration. The video has to be turned on. Participations are not, which is all the time quiz duration. The video has to be turned on. Participations are not advised to leave the platform. Once the answer is submitted, it will not be possible to revert. It is advisable to use the different, you need not, you should different connection if you want to watch it, but don't watch it in the same. Advice to participate from a place where there's a good internet connectivity. It's found to be any type of foul play, it will be automatically disqualified. And you should not seek any assistance for getting answers from any colleague sitting nearby. Fever Foundation is not responsible for any form of technical error. Participation in the quiz implies that the participants accept the integrity of these rules. The participants who have given incomplete or inaccurate personal or contact details will be disqualified. Non-compliance with the rules results in automatic cancellation of the participation in the quiz of the candidates for the prize, and the quiz masters and judges' decisions will be final. The quiz is in the form of multiple choice questions, and the images what you see in the quiz are only representation. You need to answer the quiz on the just below your images. You find the option by pressing the select option and submit. You will be your answer will be recorded. So it's only the images, not to click on the image. Anyway, we'll be having the first dummy round for you to be familiar with the platform that you are using. So with this, I wish you all the best for this program, and I hand it over to Dr. Jagdish Chennappa, sir, for taking over, sir. Over to you, sir. Thank you.
Thank you very much, Dr. Manjula, and excited to be here today. My senior, Dr. Sukumaran, is with us today. Dr. Anand Vasudev is there, and the famous Dr. Sudarshan is here as the arbitrator in case something goes wrong, or the jury master. So, what we will do today is to run through first a few dummy questions so that you are very comfortable with the platform, and then Dr. Manjula has already given you all the rules and regulations. Please follow them. These questions are not difficult. They require a little thinking, but I'm sure all of you all will do it. And if you are sure of the answer, hit the button soon, because we will also be looking at how fast you hit the button. So you will be given 15 seconds, as Manjula mentioned, and you'll have to answer these questions within that time frame. So, Dr. Manjula, we can start.
Right, sir. Okay. Oh, yes. Again, rules and regulations have been placed, sir. For postgraduates only, consist of multiple choice question. Option is selected by clicking on the button on the text panel. Please note this, the video display option is only for representation. The participants are advised not to leave the platform. Once the answer is submitted, it not be possible to revert. No negative marking. The winner will be the maximum fast right answer. If there is a tie, there will be a tiebreaker round, which will decide the winner. It's advisable to use the laptop or desktop. Advised to participate from a place where there's a good internet connectivity. If found to be any type of foul play, it will be automatically disqualified. And please do not use mobile phone for getting answers from any other colleague sitting nearby. Fever Foundation is not responsible for any technical error for poor internet connectivity. So participation in the quiz implies the participant accept the integrity of these rules. The participant who have given incomplete or inaccurate personal or contact details will be disqualified. Non-compliance with the rules results in automatic cancellation of the participation in the quiz and candidature for the prize. The first and second winner from each zone will enter the national level quiz at FEFCON 2024, which is scheduled to be in November. Quiz master and judges decision will be final. So as we mentioned, each question will have 15 seconds. You need to answer, and fastest right answer will get the marks, no negative markings. So over to our quiz host and master, Dr. Jagdish sir and Sukumaran sir. These are demo questions, Dr. Sukumaran sir.
Okay. Good evening, everybody. The first question is, which country is called the land of rising sun? There are four answers: New Zealand, Australia, China, Japan. Your time starts now.
Timer, please. Your time
Yeah.
stands. Okay, sir. Can we have the right answer, please?
So the right answer is Japan. Yes, now let us see how many people was answered the correct thing.
So I know it's just a dummy question for you to get familiar with the platform. There will be 3 such dummy questions before we go to the main. Computer
Look at
G,
the
can we
answers.
have the answers? Yeah, graphs. So are we getting the graph or should
No,
we?
no, no, no.
Yeah.
We'll see. We'll see now.
Yes.
Okay, okay,
Very
okay.
good. 100% right answer.
Okay, 100% right answer.
Very good.
Okay,
Yeah, yeah.
right, right. Next question. We go for the next question.
See, you will also know who answered it fastest.
So this
In this,
Vivek
the
Andam.
name, he
They were
answered it
from
fast and he answered it in 5 seconds. So he was the fastest to answer. So this is just to give glimpse of how the quiz happens
Okay.
and how it is going to come.
So you
Okay.
must answer very quickly. Click it
Yeah.
very quickly. Time is also important.
Next demo, sir.
The second demo question. Which star is nearest to our planet? A is Sun, B is Sirius, C is Vega, and D is Mercury. Your time starts now. Answer?
Can we have the right answer?
The right answer is A, is Sun. Now we will see how many people have marked the correct answer.
I think again 100%, I guess. So can we have the graph if it is ready?
Graph is ready?
Can we show the graph? Oh,
Oh, I think 50% has given the correct answer. 50%. Okay. We'll go to the next question.
no, who is the fastest? Can we see,
Yeah.
sir?
Yeah. Again, the same person. Vivekanandam.
Same. Okay.
He's from
2
Development
seconds.
Institute of Medical Science. Okay. Congratulations, Vivek. We'll go to the next question. Which is the largest living mammal? Which is the largest living mammal? Blue whale, elephant, rhinoceros, and hippopotamus. The very easy question. Your time starts now.
Can we have the right answer, please?
So the right answer is blue whale. Answer number A. Now, can you show the graph?
So I'm sure they will. Most of it will be correct this time. All of them will get it.
I think it's a very easy question.
Yeah.
The question is school level. It's a school level
Yeah,
question.
100%.
No,
Very good.
100%. Okay. Congratulations to all.
Yeah. So they need
Let's show
about, RX event says they require about 15-20 seconds to collect the
Okay.
graph when an actual graph happens.
So the correct winner, the winner is Anupriya from DMCH. Just taken only 2 seconds.
Okay.
Congratulations, Anupriya, for the correct answer.
So now that demo is over, I'm sure, sir, they are
So,
familiar. Can we start the main
so
questions?
we will start the main question
So
now.
please, all of you know now my main quiz starts and the marks will be allotted, not based on demo. So now actual quiz is starting. Kindly be ready. Let your fingers be fast, actually. So wishing you all very best. Over to our quiz master.
Okay, start the first question. The first question is, what is the definition of hyperthermia? The first answer is A, fever more than 38.5 degrees Celsius, fever more than 39.5. C is fever more than 40.5 degrees Celsius, and D is fever more than 41.5 degrees Celsius. So what is hyperthermia? So time starts now. Correct answer? So correct answer is D, fever more than 41.5 degrees Celsius. So the fever should be very high, we call it as hyperthermia. And do you know what is the management? The management of hyperthermia is mainly cooling, environmental cooling. It is due to rising environmental body temperature. Now let us see who has answered the correct. Show the graph now.
Yeah.
So fever for more than 41.5 degrees Celsius is hyperthermia.
Yeah.
Yeah, there are two groups.
All 33, 33.
33, 30, 30, oh, everything is 33. 33.
Just Chinmay Jena, I think the important thing here, Dr. Sukumaran, is that it should be temperature more than 41.5 degrees.
Uh,
So it is Chinmay Jana
Yes.
from Kalinga Institute of Medical Science has given the correct answer. We'll go to the second question. What qualifies as fever or pyrexia of unknown origin? The question is pyrexia of unknown origin. First answer is a single illness in which fever without diagnosis after 2 weeks of outpatient. B, one week in patient evaluation, including laboratory workup, both A and B. D, none of the above. So your time starts now. What is the correct answer? Correct answer is both A and B. A single illness in which fever without a diagnosis after 2 weeks of outpatient treatment. After an outpatient, the patient is investigated and if we cannot arrive at a diagnosis. And second is 1 week fever of patient evaluation, including laboratory workup. The patient be admitted. After admitting and you evaluate for 1 week, and if you cannot make a diagnosis, it is pyrexia of unknown origin. As you all know, the commonest cause of pyrexia of unknown origin may be infections, second may be inflammatory disorders, and third may be malignancies.
Melaplastic. Yes, sir. Thank
Show
you.
the graph now.
Yeah, can you show the graph?
Again, out 33. First 3 persons have
I know.
33%. So winner is Vivek and then again the person who has correctly answered the mock questions. Time taken is only 1 second. Congratulations, Vivek. So we'll go to the next question. Question 3. If there is a traumatic lumbar puncture, what is the minimum time duration to wait after which repeat LP can be safely performed? So we can do a repeat LP after 24 hours, 48 hours, 72 hours, and after 4 days. So what is the time taken to clear the CSF? The time starts now. So the correct answer? Correct answer is 48 hours. So most of the time in children, it is very difficult to do a lumbar puncture in a child. And child may be struggling. And always the child may be struggling and you may get a traumatic tap, a blood-stained tap. And it is very difficult to make a diagnosis from a blood-stained tap. It is seen that 1000 RBC, 1 milligram protein elevation is there. Correct answer is 48 hours. So you repeat lumbar puncture after 48 hours to make a correct diagnosis. Now show the graph now.
Can we have the graph, please?
So the correct answer is B. That is given by 33%. 33% of the students has answered the correct answer. The winner is there is no correct attempt.
Nobody.
Unfortunate.
Okay.
Unfortunate.
Unfortunate. Yes, sir. Nobody got it right. Okay.
Oh, the fourth question is commonest organism causing urinary tract infection. The answer A is Proteus mirabilis, B is E. coli, C is Pseudomonas aeruginosa, and D is Shigella species. So your time starts now. So the correct answer. So the correct answer is B. As you all know, the commonest organism that produce UTI in a immunocompetent child. Immunocompetent child, you can say it is mainly E. coli. Pseudomonas may produce infection in an immunodeficiency child. Shigella usually will not produce UTI. Shigella usually produce dysentery. Proteus mirabilis UTI may be associated with obstructive uropathy. So the commonest organism causing UTI is E. coli. The correct answer is B. Show the graph now.
I'm sure 100% would have got it right now, sir.
Yeah,
This is
maybe
the
100%. It's a very simple question. Huh?
Oh yeah, Dr. Jagdish sir, your take on this. 100% your guess. Yes.
Yeah, as you said,
Correct.
100%. Correct answer. Okay.
Can
We'll
we-
go to the next question.
No, sir. Who is the winner?
The winner is Vivekanandam. He is from again from Jawaharlal Nehru Institute. It took only 2 seconds.
Hmm.
Congratulations, Vivek. Oh, okay. Then we will go to the fifth question. The dose of cefixime for enteric fever is 8 milligram per kg, B is 10 milligram per kg, C is 20 milligram per kg, and D is 50 milligram per kg. It is not the usual dose of cefixime for management of enteric fever. So the correct answer. So the correct answer is C. For management of enteric fever, you must give a high dose of cefixime. The usual dose of cefixime is 8 to 10 milligram per kilogram body weight. The main indication for cefixime is for the treatment of UTI, treatment of dysentery, then peritonitis, all infections below diaphragm, you give cefixime. For all infections above diaphragm, mainly respiratory, the third generation cephalosporin of choice should be cefprioxime. So the correct answer is C. Please show the graph now.
Yeah.
Yes.
Yeah.
C. 67% has answered as C correctly. Who is the winner? Again, the winner is Vivek is from Jawaharlal Nehru Institute of Medical Science, and he has taken only 3 seconds. Hearty congratulations to Vivek. Now coming to the sixth question. As per new WHO Module 5, the duration and number of drugs for continuous phase of non-HIV, non-complicated pleural disease is 3 drugs for 4 months, 3 drugs for 3 months, 2 drugs for 2 months, 2 drugs for 3 months. Category 1, and the treatment of choice was 2HR is a D. 2 months course of INH, rifampicin, pyrazinamide, ethambutol, followed by 4 HRE. This 4 HRE. Now the course has reduced to 2 months. 2 months. This 2 months course of HRE.
22, and these are the new guidelines for treating pleural or lymph node tuberculosis disease for shorter duration. We need to give pyruvate. I think nobody's got it right.
Nobody is going to answer. See, I think all has studied this 4 months now. No correct attempt. Okay, we'll go to the next question. 7th question. Which is the commonest cause of bacterial pneumonia, community-acquired pneumonia in the community outside the neonatal period? It's outside the neonatal period, after the neonatal period. Answer A is Streptococcus pneumonia, B is H. influenza, C is Streptococcus pyogenes, and D is Staphylococcus aureus. Okay. The correct answer is Streptococcus pneumonia. I think they had not.
It has to be
answered.
disqualified.
Disqualified. I think this
Disqualified because it did not start.
Yes, sir.
They have not
Yeah.
started answering now.
Yeah.
Okay.
So
This question goes away, right, sir?
Now, question number 8. The ideal antibiotic of choice for community-acquired pneumonia in a 5-year-old child is answer A is amoxicillin, B is amoxicillin clavulinate, C is ceftriaxone, and D is meropenem. Now your time starts now. Show the answer now. So answer is amoxicillin. For treatment of community-acquired pneumonia, the antibiotic of choice is oral amoxicillin. As you all know, the commonest organism is pneumococci. So the first drug should be amoxicillin in the dose of, you can hear high dose of amoxicillin, 80 milligram per kilogram body weight should be given for 5 days, according to the recent WHO recommendation. Ceftriaxone may be tried in admitted patients with severe pneumonia. And the drug of choice for a community-acquired pneumonia as an OPD management should be amoxicillin high dose. Show the percentage now. Show the graph now.
Yeah. Please show the graph. Very good.
Very good. 100%.
No, all of them are given.
All wrong answers.
All wrong answers. Oh, okay. I thought it is 100% was correct. All wrong answers. And the answer given is the second one. Second one.
First one was correct, amoxicillin.
Yeah.
They've chosen amoxiclav.
Yeah. See, people think that is amoxiclav. Actually, it's not amoxiclav. Amoxiclav is not indicated. Again, it is amoxicillin. It's a drug of choice. Okay. We will go to the next question. What kind of infections are common in children with chronic granulomatous disease, microbiologically speaking? A is oxidase positive organisms, oxidase negative organism, catalase positive organism, with microbacterial infections. Is the correct answer?
No,
Your
right timer.
time starts now. So the correct answer is D. Catalase positive organism and microbacterial infections. As you all know, CGD, chronic granulomatous disease, is an immunodeficiency disorder, and these children will present with recurrent infections, recurrent abscesses, especially the lung and liver. And the common organism is catalase positive organism, and also they can have infections with Mycobacterium tuberculosis. The correct answer is D. Please show the graph.
No, who is graph and winner? Correct, sir. Yeah, okay.
So all 33%. Now 33%.
Right.
Each. Okay, who is the winner? From Kaliga Institute of Medical Science. She took only 2 seconds. Congratulations to Chinmay. Now you go to the 10th question. Which of the following is or false for fever in children with immunocompromised conditions? 1, they will have mild subtle fever with focus or without focus, may turn out to be a serious invasive illness. B, the infection of greater magnitude may have minimum or only low-grade fever. C, interpretation of test may need to be consideration, high rate of false negative due to immunosuppression. All the above are true. Your time starts now. Correct answer? The correct answer is D. All the above are true. Jagadish, any comments?
Yeah. So I think the important thing here is that in the immunocompromised condition can present with a wide range. A mild subtle fever can, without focus, can become a very severe invasive illness very quickly. So that has to be kept in mind. Fever is basically because of producing inflammation. In a child who's got immunodeficiency, he may not produce an adequate immune response and therefore may not produce the interleukins that are required to produce fever. And therefore, the slow fever may be there. And finally, of course, you might get an interpretation because of high rate of false negative due to immune suppressants which are there in the immunocompromised state. So I think all of them have got it right.
Yeah,
Yes,
100% got the correct answer by 100%. Okay.
Very good. So who is the
Who's the
winner?
Anupriya from DMCH. She has taken only 2 seconds. Congratulations, Anupriya. Okay. Are we showing the score now or later? We have finished 10 questions
We'll
now.
finish. No, okay, so we'll finish them.
Okay, right. Now question 11. Which antitubercular agent is the least hepatotoxic? Isoniazid, rifampicin, pyrazinamide, and ethambutol. Your time starts now. Pyrazinamide can produce hepatotoxicity and gout. Can produce secondary gout also. And ethambutol, the main problem is optic neuritis. So the correct answer is
we will discuss
meropenem, IV tigecycline. I think C and D is both IV tigecycline.
So we will keep only 3 options.
Okay. IV clindamycin, IV meropenem, and IV tigecycline. Okay, your time starts now. So the correct answer. The antibiotic is the bactericidal antibiotic is IV meropenem. IV meropenem is a broad spectrum antibiotic which is mainly effective for both gram-positive and gram-negative organisms. It is mainly indicated in the treatment of complicated pneumonias and meningitis. See the
in all fairness, even this has to be disqualified because it is audio visual. Somebody would have seen 4. they may not be listening to what you have told, only 3. So I think this also has to go, is my recommendation.
True, sir. But the point is that even if D you take a stereocycline, both of them are bacteriostatic.
Yeah.
No, but there is an error in the formatting itself. Do we have
Yes.
sufficient? See, fairness is 100% accuracy.
Agreed,
See,
sir.
we are perceiving you are all experts, but they are postgraduates. They are postgraduate. They are tense. They are
Sir, I
tense.
think there is no problem in this question because of
No. You are expert. You are
23 or 4.
expert. So yeah, do we have sufficient question bank, madam? Yeah,
Yes, sir. We have.
We
have.
have,
yeah.
we have,
I
sir.
think yeah. Though of course it is a repetition. I can see common sense, but the tense person, they may not read that. See, see, it should be 100% accurate. The question, the answer, the presentation, and the reply. So kindly remove this with the due apologies to FeverFoundation
Okay.
and the pediatricians.
I think that we will remove this. Sir,
Yeah. Kindly, yeah. Because they are all youngsters. We should be fair and they should go satisfied that they did the best and good enough. Yeah, please.
Question number 3. Which species of Plasmodium do we need to give prophylaxis to prevent recrudescence? Falciparum, Vivax, Avail, both B and C. Your time starts now. Okay, your time starts now. What is the correct answer? Jagadish, your comments, please. I will just come. Comments.
Yes, sir. I think the prophylaxis is not required in falciparum malaria, but the other two, though oval is very rare in our country, still oval and bival. Oval is found in few pockets only, but we need to give prophylaxis to prevent recrudescence.
Okay. So if the graph is ready, can we have the graph?
Yeah, 33%.
Yeah.
33% have got it right. So let's see the
Who is the
fastest. Right, let's go to the 14th question. Daptomycin is a new MRSA drug, is not helpful in pneumonia or lung abscess because A, penetration in the lung parenchyma is poor. B, it is inactivated by surfactant. C, penetration in dead tissue and pus is inferior. D, it causes reflex life-threatening bronchospasm. So which is the correct answer?
Your time.
Your time starts now.
Yeah.
So the correct answer. The correct answer is B. So daptomycin, a new drug against MRSA, the main problem is inactivated by a surfactants. So the correct answer is B. Jagadish, any comments?
Yeah, so when you have a very severe MRSA infection, then the drugs of choice would be vancomycin, ceftriaxone, which is a new drug which is available for MRSA, but you cannot use daptomycin because of its because it is inactivated at the lung level by surfactant and will not act against the organism.
Show the graph now.
If the graph is ready, can you just display it, please?
Again, we need to look at whether this is community acquired or hospital acquired.
Yeah. Oh, the 67% people have given the correct answer.
Yeah.
Who is the winner? From Jawaharlal Institute of Medical Science. He has taken only 4 seconds. Congratulations, Vivek. Next question. The commonest agent causing croup syndrome is A. Haemophilus influenza, B. Streptococcus pyogenes, C. respiratory syncytial virus, and D. Parainfluenza virus. Your time starts now. So the correct answer is D. The correct answer is D. Viral croup is or acute laryngotracheal bronchitis is a viral disease mainly produced by parainfluenza virus, influenza virus, and rarely mycoplasma pneumonia can also produce this croup syndrome. But respiratory syncytial virus, as you know, mainly produce bronchiolitis.
Yeah, one of the new viruses that can produce croup is the COVID-19 virus.
Oh, right. COVID also can produce croup, viral croup. Okay. So,
Yeah.
100% has given the correct answer. No?
Very good.
Anupriya from DMCS has given the correct answer. She took only 2 seconds. Okay. Question number 16. Which of the following infections are highly possible with splenic microabscess? Tuberculosis, melioidosis, brucellosis, all of the above. Your time starts now. So the correct answer. So the correct answer is D. All these infections may be associated with microabscess in the spleen, and tuberculosis can occur. Melioidosis is an infection that can present with severe sepsis, pneumonia, or multiple abscess. Brucellosis, as you know, they present with an FUO, the prolonged fever, splenomegaly, and arthritis is a common manifestation of brucellosis. All this can present with microabscess in the spleen. Jagadish, any comment?
Yeah, I think the important thing to realize here is that all these three infections predominantly involve the reticular endothelial system. And therefore, the spleen is one of the sites of a large amount of lymphoid tissue, which is part of the RES system. And therefore, you can get abscesses because of these. However, the commonest disorder, if you find microabscesses, is brucellosis. Melioidosis and tuberculosis are a little rarer compared to brucellosis in producing splenic abscesses. Melioidosis, as Dr. Sukumaran mentioned, septicemia, pneumonia, can also cause a peculiar form of skin rash and prolonged fever, and is very easily treatable. It's been reported more frequently in southern India, and therefore one needs to keep an eye out for it. Tuberculosis is a great mimicker and can present with infections in any part of the body, and the spleen is no exception.
Okay. Now,
Please.
show the graph now. Now, I think the 67% has given the correct answer, D. Okay. Who is the winner? She took only 2 seconds. Congratulations, Chinmay. Now we'll go to question number 17. Which of the following is not a red flag sign in a child presenting in ER, emergency room? A capillary fill time more than 3 seconds, dull lethargic child, C, irritable crying child. D is diffuse macular rash. So it is not a red flag sign in a child presenting to ER. Your time starts now. So the answer. So answer is diffuse macular rash. So all the other three conditions, if capillary refill time more than 3 seconds, dull lethargic child may have meningitis. So it is a danger sign. Irritable child, crying child may again have a meningitis or an ASOM. Oh, so all these three are not a danger, is a danger sign. But the diffuse macular rash, which is most probably seen in a viral exanthem, is more commonly seen in a viral exanthem, is not a red flag sign in a child with sepsis presenting with the ER. So the correct answer is given by 33%. 33% has given the correct answer. Who is the winner? Yes, we will move to the question number 18. Which of the following is aerosol borne? Tuberculosis, varicella, measles, D is all of the above. Your time starts now. So the correct answer. So correct answer is D. See again, as you know, tuberculosis, they're spread by aerosols. Varicella also spread by aerosol. Measles definitely spread by aerosol. So all these three infections, they are mainly spread through aerosols. So the answer is D. Please show the graph and who is the winner.
What do you say, Sukumaran? Should be 100%?
100%. Should be 100%. Definitely, it should be 100%.
Should be 100%.
Because some clues are there. Some clues are there in the answer also.
Correct, sir. 100%.
Yeah, yeah. Because even there are some clues in the answers. Because if they are very sure that two, definitely measles and TB definitely spread by aerosols. Then the third one is also aerosol. So congratulations, Anupriya. She has answered in 1 second. Okay. 19. Which is the only cephalosporin in this list that is available as IV and oral form in India? Cefazolin, cefalexin, cefotroxil, and cefuroxime. Your time starts now. അവിടെ നിൽക്കാൻ പറഞ്ഞേ 5 നമുക്ക്. So the correct answer. So the correct answer is cefuroxime. Cefuroxime is is a second generation cephalosporin that is effective both for gram-positive and gram-negative organism. Both is available. It is available as oral form and injectable form. The injectable dose is 50 milligram per kilogram body weight 8 hourly. Oral may be around 30 milligram per kilogram body weight in 24 hours. The main indication for cefuroxime is in the treatment of complicated community-acquired pneumonia. Cefazolin is available as injection. Cefalexin is available as oral, mainly used for prophylaxis of UTI and skin and soft tissue infection. Ceftriaxone is also available as oral, and the main indication of ceftriaxone is for treatment of skin and soft tissue infection. So the answer is D, is available as injection and oral.
Only 33%.
So only 33% has given us the correct answer. Who is the winner? It took only 1 second. Congratulations,
Vivek.
Vivek. Question number 20. What hematological disorder would you ideally screen for prior to starting anti-malarial prophylaxis? So before starting anti-malarial prophylaxis, with hematological problem, you must exclude A is G6PD deficiency, B folate deficiency, C sickle cell disease, and D is thalassemia trait. Your answers, time starts now. Please show the correct answer. The correct answer is G6PD deficiency, because some of the anti-malarials are given to children with G6PD deficiency. They will have severe intravascular hemolysis. They are manifest as severe pallor, jaundice, and hemoglobinuria. So be careful about G6PD deficiency when you prescribe drugs like Primark.
Another 100%, Dr. Sukumaran?
Yeah, maybe 100%.
Yeah.
100%. Show the graph now.
Oh,
Oh, no.
Oh, but it is nearly 67%. 67%.
yes, sir.
So
Okay,
let's
who is the winner? From Kanika Institute of Medical Science. She took 2 seconds. Congratulations,
now-
Chinmay.
Yeah, so Dr. Manjula, now we'll have 3 questions, is it?
Yes, sir. Three
Three
more we'll have, sir. Additional. We have
Yeah.
only 17 completed.
Yes, yes, yes.
Yeah.
Yeah. So computer G, and can you continue?
Next question. A recurrent fever with abscesses is seen in which condition? Hyper IgE syndrome, chronic granulomatous disease, SIDS, and agglomaglobulinemia. The time starts now. So the correct answer is B. Actually, we have discussed this question before also. I told about chronic granulomatous disease. It's an immunodeficiency disease. These children will have a partial oculocutaneous albinism, and they can present with multiple abscesses in the liver, lung, etc. So the correct answer is CTD. Show the graph now.
Oh,
Oh,
So you are taught well, Dr. Sukumaran.
yes. Who is the winner? Yes. Next question. Which cephalosporin does not penetrate the CNS into the CSF? One is IV cefazolin, IV cefuroxime, IV cefepime, both A and B. The correct answer. So the answer is D. D means both A and B. No, there are three, two. First is first generation cephalosporin. Cephalosporin is cephalosporin. Cefuroxime is a second generation, and cefepime is a fourth generation cephalosporin. Of this, cephalosporin, the main indication of cephalosporin is post-surgical, and somebody has written it is not available now. And cefuroxime, as I said before, it is effective for gram-positive and gram-negative organism, mainly used for treatment of inpatients with pneumonia. IV cefepime, the main indication for community-acquired severe sepsis, we use cefepime. So answer is D. This drug should not be given for treatment of meningitis. Treatment of meningitis, you must give a cephalosporin which has got maximum CS of penetration. And the best drug should be ceftriaxone. So the 100% people has given the correct answer. Answer is D. So show the winner. Again, Vivek. He has completed within 2 seconds. Hearty congratulations to Vivek. Next question.
It's the last question, 20th question.
Oh, okay. Last question. Which antituberculous drug is known for causing retrobulbar neuritis? INH, rifampicin, pyrazinamide, ethambutol. Your time starts now. So the correct answer. The correct answer is again D. Among these drugs, the main side effect of INH is, as I said before, it can also produce peripheral neuropathy. Peripheral neuropathy, hepatotoxicity. Rifampicin produce hepatotoxicity and a flu-like illness. Pyrazinamide, hepatotoxicity and hyperuricemia. Ethambutol can produce optic neuritis. It usually produce optic neuritis and retrobulbar neuritis, but retrobulbar neuritis as such is very rare in children because in all regimes of treatment of TB, now you recommend ethambutol. It is 2-HRE study with 4-HRE. You routinely give ethambutol, even though it produces retrobulbar neuritis. It's a rare complication of ethambutol. Let's show the graph now.
100% another guess.
Maybe 100%.
Yes.
Okay,
Yeah.
100%, as Madam said. So, congratulations to all. So please show the winner. Is again Chinmay Jana, Kalinga Institute of Medical Science. No, madam?
Yeah, I think they will
No.
evaluate, is there a tie or anything? So then, so we'll have to go. I think there will be, maybe they need to tell us, sir.
I think there will be no tie.
There'll be no tie? Yes.
There will be no tie.
Madam, do they hear us if we speak?
Yes, sir. I think they can hear us. Yes, sir. They're hearing. Yes, sir.
Okay. Then I keep quiet. Over.
Okay, right.
So, Computer Ji, can you please tell us? I'll just check, sir. So they're going to give the results.
Yeah.
So we'll wait for them. If you want to speak anything to address the participants, you can do one few seconds, a minute or so.
Okay.
Anything you want to tell them, sir? I would like to just tell them there is a poster presentation, a competition which is planned. So you can submit your poster related to fever. So that will be another competition for postgraduates. These posters, the last date for submission of your poster is 10th September. And the competition, actually, you will be making the presentation. The competition will be held on 17th or 18th October. So please do submit the poster. The link and all will be sent to you. On this poster, only condition is has to be related to fever. Anything related to fever. And also, I invite you all to attend FEFCON 2024, which will be in November. We will share all the dates and the link to you. Please, it's a free registration. Please register. You will have a really exciting session. Top pediatricians across India and some international speakers also will be there to discuss various aspects of fever management. And also there will be different specialities, infectious disease, critical care specialist, and other specialities also. Epidemiologists will come and discuss. So you will have a really, I can say, scientific fiesta during that time. So please request you to kindly register and join the Fever Foundation conference and FEFCON. Sir, over to our quiz host.
Where is the venue, madam?
Okay.
Sir, we will inform, sir.
Dear friends, that was
Okay,
a
okay.
relatively easy questions for PGs. This is a tough question. I think you have to face, the winner should face tough questions in the final.
Yeah,
Final should
yeah.
be more tough.
Okay, sir. Jagdish, sir, your views, sir.
I think the it's not only the difficulty of the question or the ease of the questions, it's who can think fast. So I think, and who can eliminate all the negative questions negative answers quickly. So I think the speed also makes a difference. So I think uh, it was basically a very good show because we had also seen that most of the people have got their basics pretty clear. So I don't think see that there was a major issue there. The only one question which I was disappointed with the answers was in the pneumonia question, where most of them answered co-amoxiclav.
Yeah.
I think co-amoxiclav is definitely not the drug of choice for a community-acquired pneumonia in our country. It is still amoxicillin. And over time, we all now know that even shorter duration of treatment of even 3 days and 5 days is probably more than sufficient to treat community-acquired pneumonias.
And also the WHO recommendation for ARI control program also, they say it is amoxicillin.
Correct.
High
So
dose.
I think that was a little disappointment, but rest of it was quite good. Dr. Sudarshan, any advice for the participants?
No, I think just yeah. From my side, I think we have conducted this quiz from an organizational point of view very fairly and very strictly, and the participants can go satisfied that the program was well conducted, and obviously the best performer will be the winner. Thank you. Thank you.
And we also are very grateful to Dr. Sudarshan for pointing out that it should be totally, absolutely clear, and there should be no ambiguity in our questions. So I think that is what he brings to the table, and we thank you very much for that.
Thank
Sir,
you. Because the students need to go happy and satisfied that they participated in one of the best quiz programs of their professional life. I think they should go with that memory. So that's why I'm little on the stricter side. Thank you. Thank you.
Thank you so much.
Thank you.
Sir, it appears there is a tie for the second place. Should we have the first place is clear and second place there's a tie? So what do you want to do, sir? We'll have a tie round second, or you want to?
We will have one question.
We'll have one question.
And the faster finger first will win.
Okay. So computer G, we will have one tiebreaker question. If you are ready, let us know. We will tell who has to play. If you can show us, should they show or what, sir? They can name. No, name the people or.
Yeah. Let them show the names of the participants.
You please share to show the first and the second and the third tiebreaker. Then we will go for one tiebreaker question, and only the second place which is tied, the winner need not participate. The other two has to participate. Correct, sir?
Yes, correct.
Yes.
And
Yeah. Yeah. So
actually
can
only
you
two of
show
them,
the results?
only two of them will participate. Actually, only the winner should not participate. Rest all can participate.
Okay. No, again tie ho jayega because
I think only two. Only two
Okay.
can participate.
this is only for two people who
Yeah.
are under tie again. Yeah. So if the score is ready, can you please show us the score, sir? Can you display the score, please? So okay, if the computer is ready, can you please show us the scoring, please? Scorer, if you are ready. Yeah, sir, Jagdish sir and Sukumaran sir, it has been displayed.
So I think the first place is clear. The second and third will decide. Will have a is a tiebreaker, I presume, no?
Yes, sir. Both of them have same
Yeah,
number,
so
same scoring.
Anupriya and Chinmay Jena will now compete for the second place
Yeah.
by a tiebreaker question.
Madam,
Yeah.
before that, can we have their individual scores? Is it possible to get their scores?
Yes, sir. It is possible. Can
Yeah.
can you
Yeah, yeah.
verbally tell?
Because
or,
they're seeing it, they are
Hmm.
seeing it.
Can you enter
Second is
Atharva?
no,
Display that.
let us. I am not in a hurry.
Yeah,
Let
okay.
it be shown. Let it be shown.
Please
Yeah.
show the total score that they
Yeah.
have.
Yes, sir.
Okay,
Yeah.
so
So
Yeah.
we'll
Okay. Good.
Okay,
yes,
very good.
Very good. 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 Now it is fine. So
right.
Vivek can, I think, relax. I think other two, Anupriya and Chinmay Jana, with the experts. Yeah, please. Thank you.
Yeah, Anu and Anupriya and Chinmay, are you ready? We are going to play the tiebreaker. Be fast. Whoever has got the right and correct answer. Sir, please go ahead, sir.
Madam, we
Sukumaran,
will
sir.
start now.
Yes, sir,
A
you start.
child aged less than 1 year with first attack of UTI should be investigated with A. Ultrasound abdomen, DMSS scan, ultrasound abdomen and mixed histogram, ultrasound, MCU, and DMSS scan. So your time starts now. So the correct answer. So in a child with a 1-year-old child, age less than 1 year, first episode of UTI, we must at least do 3 investigations. You should have an ultrasound abdomen, then you must have an MCU, and later you must have a DMSA scan to look for cortical scar. Can you show the winner now? Who is the winner?
Yeah, it's mainly for Chinmay and Anupriya. Hope one of them got it right. And fastest. Both might have got it right, but who is the fastest? So if the scorer is, both of them have got it right, but who is the fastest? No, both of them got it wrong, I think. Correct, sir?
No,
No
no.
correct attempt. Both of them got it wrong.
Oh,
Let's
Both of them.
take the next tiebreaker one.
So please take the next tiebreaker question.
the set point in anterior hypothalamus is set at a higher point by the action of interleukin 1, 6, TNF alpha and prostaglandin E2, B, cortisol, epinephrine or norepinephrine, D, all the above. Your time starts now. So the correct answer. So the correct answer is A, interleukin 1, 6, TNF alpha and prostaglandin E2. They are mainly concerned with thermogenesis. Other hormones like cortisol, epinephrine has no role in thermogenesis. So the correct answer is A. Who is the winner?
So what is the guess, sir? Are we going to get the clear winner in this?
Yeah.
I think both will be right, but one will be faster than the other.
Right, right. So if the scorer is ready, can you let us know if you are ready with the graph and the... Yeah. So who has given the right answer now?
Right answer is A.
Yeah, yeah. One of them has
Only
given.
50%. Only 50%.
Chinmay.
Chinmay Jana has given the correct answer in 2 seconds. Congratulations, Chinmay.
Chinmay.
Again.
So now that we have the clear winner, can we stop, sir? Results.
Yeah.
Yeah.
So
Can we show the result now, first and second?
yeah.
Yeah.
So the first is Vivek Andam from Jawaharlal Nehru Institute of Medical Science, Manipur. And second is Chinmay Jana from Kalika Institute of Medical Science, Odisha. Congratulations and best of luck to both of you. Thank you, man. Thank you.
Thank you. Dr. Vivek and Dr. Chinmay, congratulations. So you will be intimated. You will be coming for the grand finale. You will be competing for the national winner competition along with the winners from the other zones. So our FeverFoundation team will keep you informed on all this. So congratulations once again. Over to Dr. Jagdish Channappa, sir.
I think it was wonderfully conducted. Thank you very much, team, for doing it really well. And congratulations to Dr. Vivek and Dr. Chinmay for participating, and all the other participants too for participating so actively. And we could see so many of them got 100% right. So the difference between all of you is very little. And I think the best wishes to all of you. and looking forward to seeing both Dr. Vivek and Dr. Chinmay in Bangalore for the final quiz at Fever conference here.
Dr. Sudarshan, sir, your
Yeah, thank you. I think it was a very good and well organized event, and postgraduates have done extremely well. Congratulations to both the winners. And even the tiebreaker, we planned only one question, but they made it two questions, and they got the benefit of two questions. And rest of it, I think they have already been briefed, and you can go happy. And those who have not been able to make it, you have made a good beginning. This is not end of the road. Please don't get lose your heart or lose your interest or spirit. You will be successful. Maybe next time. Keep trying. Wish you all the best, everybody. Thank you.
Dr. Chetan, sir, is on platform. Would you like to say, sir, anything?
Yes, yes. No, it was very nicely conducted, this quiz. And yes, there were questions where they have given the correct answer in a perfect time. So this is going to be there in the quiz. But I think in tiebreaker, we should be directly focusing, like splashing the questions so that maybe once we read, then both of them may know the answer. They may give in the same 2 or 3 seconds answer. So that's the only, because already we are reading the questions. But fine, it's as far as this quiz is concerned, we get clear winner. So many congratulations to winner, and congratulations to all other who have participated, because participation here, the goal is not to make you win or lose. The goal is to disseminate the knowledge by the way of this quizzing. So quizzing is the best way to learn the things, and that's what Dr. Sumukumaran was giving the explanation just for you to understand why this answer and what message we can get from this particular question. Thank you so much, and all the very best.
Thank you, sir. So with the permission of all of you quiz master, quiz host, and the jury, so we would like to close this, and I wish you all the best for all the participants for having participated in the quiz, and congratulations to the winner. Our team will be in touch with you. All the participants will get the participation certificate, so which will be reaching you at the registered email IDs what you have shared with us. So with this, sir, with the permission, can we close the meeting, sir?
Okay. Thank you, ma'am. Thank you.
Thank you.
Sir.
Dr.
Namaste.
Singh.
Namaste.
Namaste.
Jagdish,
Do you
Thank
want
you,
me at 7
thank you
o'clock,
very
madam?
much for, yes, sir, 7 o'clock. Quiz masters and quiz host and the jury for helping us in conducting this excellently. Thank you so much, sir. And we are totally indebted to you all. So our marketing team and the RX event, thank you so much. And digital team.